So, can Narcan reverse a fentanyl overdose? Yes, plain and simple. Narcan, also known as naloxone, can effectively reverse a fentanyl overdose. Fentanyl is incredibly powerful and around 50 to 100 times stronger than morphine. The high potency makes it extremely dangerous and susceptible to overdoses. Now, in a fentanyl overdose, Narcan operates as an opioid antagonist. Basically, it competes with opioids like fentanyl for the same receptor in the brain. Now, during the overdose, the opioid receptor becomes overloaded, which can depress breathing to life threatening levels, otherwise known as respiratory compensation. When administered Narcan, it knocks the fentanyl molecules off the receptor and takes their place. Think of this like turning off a light switch. This action quickly blocks the effect of opioids in the body, reversing the potentially fatal overdose. The result is often rapid and can temporarily restore normal breathing and consciousness, buying the necessary and valuable time for professional medical help to arrive. And the statistical data backs the efficacy of Narcan reversing opiate overdoses. Over 80% to all individuals experiencing opioid overdose survive when treated promptly with Narcan. Now, let's discuss a step by step guide on how to use Narcan in the event of a suspected fentanyl overdose. First, identify the signs of an overdose. Signs of fentanyl overdose can include pinpoint pupils, unconsciousness, slow breathing, or completely stopped breathing. It's crucial to act fast if you suspect an overdose. Next, always start by calling for professional medical help and call 911. Even with Narcan, a fentanyl overdose is a medical emergency and it requires immediate professional intervention. Next, administer the Narcan. So if you have Narcan nasal spray, lay the person on their back first. Then insert the nozzle of the Narcan spray into one nostril. Press the plunger firmly to release the dose of Narcan. If you're using the injectable form, it's fairly easy. Just inject into a large muscle like the thigh. Next, perform rescue breathing. If you notice the person is not breathing or breathing shallowly, start rescue breaths while waiting for the Narcan to take effect. Please monitor the person. Narcan should start working in about 2 to 5 minutes. If the person doesn't respond within 3 to 5 minutes, you must administer a second dose of Narcan. Lastly, stay until help arrives. If the person revives, waiting for professional medical help is essential. Fentanyl is so potent, its effects can actually outlast Narcan, meaning the person could go back into overdose and then require the second dose we talked about earlier. So remember, Narcan does save lives, but it is a temporary solution. It's not a substitute for professional medical care. So no matter the situation, if you suspect an overdose, call 911.